Tim Bennett here from the Cortland Voice, and I'm here with Dr. Shah from Cayuga Health. Doctor, how are you today?
I'm good. How are you? Thank you for having me.
I'm doing well, thanks. So before we speak on your specialty, which is pain management, I want the community, to get to know you. So doctor, tell us about yourself.
Sure. So I have a specialization in pain management. I'm also an anesthesiologist. I've been here in the area. I live in Ithaca for the last 3 years. Originally, I'm from New York City. I did all my training down there at Columbia Presbyterian, but happy to be here in this area and contributing to the community.
Beautiful. So being that you specialize in pain management, everyone knows some sort of pain, but break down what is pain management for the common person to understand.
Yeah, absolutely. So we treat any kind of pain that has become chronic. So typically, by definition, that's going to be 3 months or more. But really, it's on a case by case basis. So if you've had any kind of pain, neck pain, back pain, knee, hip, or really anything else that's been bothering you for a while, that's something we specialize in.
So what are some common misconceptions about pain management that people have, maybe even some without medication, with medication? Like, what are some common things that people think they know, but they don't?
Yeah, absolutely. Probably the number one misconception is the fact that you can actually have good pain management without medications.
Hmm.
Most people out there who have pain have been on pain medications for a while, but really there's a lot more ways to treat your pain.
Okay. Now, can you explain the mind body connection and how that relates to pain management? Like, what does that mean?
Yeah, absolutely. And that is one of the ways to treat pain without medications is to tap into that mind body connection. So of course your body is going to be connected to what you're feeling and what you're experiencing. But even at a subconscious level, if you've had pain for a long time, your brain and your body may start to get used to that. And so we have to work on that connection in order to start to reverse some of that pain.
Gotcha. So that's almost like how you might tell yourself you're hungry and then you feel your stomach. You say you're tired, you yawn. So your mind is telling you that. Is that basically what you're saying? Am I
Yep.
close?
Yep. You got it. Yep. That's it.
Got it. Okay. So what are some of the most effective non-medication techniques for managing pain?
Yeah, absolutely. So if you have been taking medications for a while and they're not working as well as you like, you want to start to look at other things that you can do to help heal your body from the pain that you've been having. Some examples would be physical therapy, stretching. Yoga has been shown by a lot of research to be very effective for chronic pain. You can also do things like meditation, tapping into that mind-body connection that you talked about earlier. We also have other things that we can do, like various injections and other procedures like that can also be very effective for pain.
Okay. So how can one who feels pain figure out, hey, this is the best practice for me? This is what I should try. Is it through, trial and error? I mean, is it through, a telehealth or coming to see you? Like how do they break that down?
Yeah, this I'm going to say something that really seems like common sense, but sometimes it's not so evident. Everybody is different, and so what works for one person may or may not work for another. So really, the best way is to get a full evaluation and come up with a comprehensive plan for treatment of your pain and see what works for you. There are lots of different things that we can do, and we want to make it customized and particular just for you.
Okay. Now, are there changes people can make in their life? Like, for example, I know many times people say, "Oh, I started eating differently." So, like nutrition, does that affect pain or?
Yeah, absolutely. And I'm sure you've heard this a million times before, but diet and exercise are so important for every part of your health and your life in general, not just how many calories you eat, but also what you eat. Fresh fruits and vegetables, cutting down on sugars, things like that are so important. And again, I'm sure you've heard this a million times, but there's actually a lot of strong research to support a couple of supplements in particular that can be very helpful. I'll give you three of them.
Okay.
One of is turmeric. This is a spice you may have heard of. It's if you've ever had a golden latte or Indian food, for example, a lot of turmeric in there has been shown by a lot of research to decrease inflammation and pain.
Hmm.
Um, other examples. One is omega-3 fatty acids. Sure, you've seen that in fish oil supplements, things like that can definitely decrease inflammation. And number three, you might like this one, is dark chocolate. Again, shown by research-based evidence to reduce pain over time.
Gotcha. So like when I go to the candy store, I'm not adding fat on, I'm just trying to reduce my inflammation.
Exactly. You can say Dr. Shah told you it's okay.
Yeah, to have the dark chocolate strawberries. I gotcha.
Yep.
So like how can someone use mindfulness or meditation to manage their pain? Tell me
Yeah.
that.
That's something that you can definitely do by yourself at home. There's lots of ways to kind of meditate and to kind of control the pain impulses that you're getting. But another way that a specialist like myself can help you is through something called biofeedback. So biofeedback is when we attach monitors to you to watch your heart rate, your breathing, your oxygen level. And through these measures, we can actually help you to control your pain and control any other discomfort that you're having. And by developing these techniques while listening to your own body and your own breathing, you can actually then develop techniques that you can use at home as well.
So let's say John Doe meets with you. They want to still be able to do certain things in their life, whether it be the certain activities or daily responsibilities, but like how can someone manage their plan? So basically, do you work with them so that they can still meet their goals? That's what I'm trying to say, like the things that they want to do and whatnot. Is that basically how it works? They tell you what's in their life and you go from there?
Yeah, absolutely. I think one of the most important things when we first meet is to find out what your goals are. And if your goal is to walk 5 miles every day or to work in your garden, that's something that's definitely important. We have a whole host of medications, injections, supplements, and things like that that we can do. And it's going to vary from person to person depending on what your goals are.
Okay. And what advice would you give to someone who's just beginning their journey of trying to figure out what they want to do as far as pain management? Obviously, everyone should go see Dr. Shaw, being you, but is it that they make a list, or what are your thoughts?
Yeah, absolutely. So I think if you're just getting started on this journey to reduce your medication usage or find something that's working better than your medications, I think the number one tip that I can give you is to be open-minded. There are a lot of things that we can do which you may have not even heard of or even thought of before and can actually help with your pain. And so for every single person, we're going to come up with a custom tailored plan that's just for you and your goals and your history and whatever is going on with your body. And so just be willing to try all different kinds of things to make a comprehensive plan to treat your pain.
Awesome. Any other thoughts or comments or maybe a message that you'd like to give to the Cortland community? Anything you'd like to say, whether it be on, this or why they should come, why use your services or anything, any message in all.
Yeah, absolutely. I just want to say that even if you've been dealing with pain or other medical issues for a while, we're always happy to see you and try to come up with a plan to get you back on your feet and feeling better. There's really no case in which there's nothing to do and you're just going to have to live with your condition. We're going to be here for you day and night just to make sure that you're feeling better. Also want to say that we service this entire community, also down in Ithaca as well. And so, if you ever needed anything anywhere in the upstate area, we're here for you.
Doctor, thank you again. And to everyone watching, thank you for choosing the Cortland Voice. God bless. Thank you.
Thank you.